True NPWT by Medela provides clinicians with options in caring for patients that enhance overall negative pressure wound therapy performance, helping to improve patient outcomes and control costs. Invia Liberty's innovative design delivers excellent versatility with its simple setup and easy operation. Liberty can be used in all care settings, easing patient transition and avoiding extra instruction time. Patients appreciate the ease of use, quiet operation, and compact size of the Liberty. The Invia Motion is a personal negative pressure wound therapy device designed for each patient, offering true NPWT with a full choice of therapy options and promoting improved patient mobility and freedom. True NPWT means offering a choice of either antimicrobial gauze or polyurethane foam dressing kits in a variety of dressing sizes and drain options. The Advanced Foam Dressing Kits by Molnica Healthcare are available in 3 sizes. Due to the green color, Advanced Foam allows for easy monitoring of blood and exudates, and the high tensile strength allows minimal fragmenting when cutting to wound size. Invia Gauze dressing kits contain all items required to dress a wound for negative pressure wound therapy, eliminating the need for a clinician to gather additional supplies. This is especially helpful in home care situations where supplies may not be readily available. Like Advanced Green Foam, wound exudate and bleeding are easily seen when using gauze. True NPWT by Medela offers customized wound therapy while enhancing performance, patient comfort, and controlling costs. Invia Gauze dressing kits include antimicrobial gauze, a non-adherent wound contact layer, transparent film, barrier film wipes, adhesive tape, sterile saline, and strip paste. Each kit configuration has a 10 mm flat drain, a 15 French round channel drain, or a transfer pad. Kits containing a transfer pad do not include adhesive tape and strip paste. All Invia Gauze dressing kits can be used with either Invia Liberty or Invia Motion negative pressure wound therapy systems. Be sure to inspect the dressing kit. Do not use if inner package is damaged or open prior to use. Make sure to properly assess, cleanse, and prepare the wound and peri-wound skin prior to proceeding to the dressing application. The Wound Assessment and Preparation chapter in this video provides information on completing these steps. Once the above has been completed, proceed to the next steps. A wound contact layer is included in the Invia Gauze dressing kits. Cut the non-adherent wound contact layer to mimic the size and shape of the wound bed. Cover as much of the wound as possible. Ensure the wound contact layer does not exceed the wound edges. Document the number of wound contact layers used in the wound. To apply the first layer of gauze, saturate a single layer of the antimicrobial gauze with the saline included in the dressing kit. Squeeze excess saline, leaving the gauze moist. Open and fluff the gauze if desired. Place it in the wound bed on top of the wound contact layer. To prepare the selected internal drain, trim the drain so it is confined to the wound bed and not touching the wound margins. When using the 15 French channel drain with undermining, cut the drain to 2 times the measurement of the undermined area, plus enough length so the drain will extend to the center of the wound. Place the selected internal drain directly on top of the gauze in the wound. For undermining, coil the 15 French channel drain until it fills the undermined area and extends to the center of the wound. Apply the second layer of gauze by saturating the additional antimicrobial gauze with saline. Squeeze excess saline, leaving the gauze moist. Open and fluff the gauze into the wound, completely covering the drain and filling the wound to the level of the skin. Do not excessively pack the wound, as this may cause further tissue damage and increase the wound size. The next step is to seal the wound with the film dressing. To do this, cut the transparent film dressing so that it will expand at least 3 to 5 centimeters beyond the wound edge on all sides. To apply the film dressing over the wound, remove the protective paper backing from the transparent film. Create an airtight seal by applying the transparent dressing starting with the side opposite the tubing. Adhere the transparent dressing firmly to the entire wound site. When you reach the tubing, lift it up and squeeze the dressing around and under the tube to create an airtight seal. Remove the window frame paper backing. Once applied, Press and smooth the transparent film dressing down firmly around the entire wound for approximately 30 seconds to allow adhesive to seal and ensure a leak-proof wound environment is established. Strip paste may be used to securely and comfortably affix tubing and to promote a good seal in difficult-to-dress areas, while protecting the integrity of the skin. To connect the drain to the NPWT device, connect the end of the drain to the Invia NPWT device tubing conical connector, assuring that all of the clamps are open. Initiate negative pressure wound therapy by turning on the Invia device at the desired physician-ordered settings. The dressing will compress when the pump starts. The dressing will contract noticeably and feel firm to touch. If the dressing does not contract, the system may not be sealed. Inspect the tubing connection and wound dressing. Reseal with additional transparent film if necessary. Latex-free, hypoallergenic adhesive tape may be used to window pane transparent dressing and affix drain or drainage tubing as necessary. Take care to avoid placing tubing over bony prominences or pressure-sensitive areas. Dressing changes are recommended 2 to 3 times weekly or as directed by a physician. Maintenance of the NPWT system between dressing changes includes routinely checking that the vacuum level is set as prescribed and that the dressing is properly sealed. Thank you for choosing True NPWT by Medela.